Hi, I'm Dr. Shane Howell. I'm a advanced proficiency activator methods chiropractor at Alternative Health Management, which is located on the west side of Houston. And so if you're not one of my patients, I recommend you see a good qualified chiropractor, preferably one that's advanced proficiency in activator methods. The reason I like that technique is that it's one, very precise, it's very gentle, and very effective. So we use a technique that uses an instrument. That's the most advanced activator up to date right now. And the technique itself involves a process of systematically evaluating the spine and the body and the joints to find out exactly where you need to be adjusted and where you don't need to be adjusted. We see all kinds of patients, from little kids and babies, and it's safe enough for those, to athletes, professional athletes, elderly, all kinds of different array of patients. So one of the main things that I'm going to talk about today is a self-treatment neck routine for my patients. So again, if you're not one of my patients, I recommend you see a good qualified doctor. So usually I recommend, these are the tools I recommend that you would need to get for this. One is a lacrosse ball. A tennis ball is adequate, but a lacrosse ball works a little better. It's a little more dense. Something like this, which I actually found this at Academy, but they also have stuff like this at Five Below. So it's like a ball inside of a little housing thing, so you can kind of roll out different things. The other thing is a foam roller. The other thing is something like a hand roller. So it's got like bicycle handles. This one's called the Tiger Tail. So this one, I think years ago I found this at Academy, but you can order online, the Tiger Tail. But it doesn't have to be that. It could be just a no-name brand, something that you essentially roll out. Other couple options that you have is some kind of resistance band. Another one is a big giant loop. And so this has a lot of options. I could loop it into things and do all kinds of different things with it. A few of these things I offer at my office for a pretty inexpensive way: the foam roller, the ball, and the resistance band. So in our office, we see a lot of patients come through our office that complain of pain, stiffness, ache, soreness in this general area. This would be our cervical spine, the paraspinals of our cervical spine, upper traps, the rhomboids, and the area of upper thoracic area. So a lot of patients work on computers. In modern society, we're all using our smartphones. There's a lot of driving in this city, so it tends to create very poor posture habits. And that's really what drives a lot of this, is just we don't really pay much attention to our posture and do things to correct it. So we end up from an ideal posture, which is everything kind of lined up to our head and neck starts to creep forward, our shoulders start to creep forward, and our upper back starts to pull back. And it's called a kyphotic position. And so with that, it creates a lot of tension, a lot of pull on the muscles coming along your neck and shoulders, as well. It can start to create tension and pull on the nerves coming out of your spine. And those nerves can cause issues like tingling, numbness, and weakness. And they can also, wherever those nerves go, sometimes they go to our thyroid, our heart. And so if there's a lot of tension, is disrupting the nervous flow to those areas. So it's real important to get those corrected. That's why I recommend regular chiropractic treatment, because it helps to normalize the movement and the position of those areas, along with the self-treatment, different exercises and things that you could do. So usually one of the first things I do is I like to roll out the neck and some of the muscles coming in and out of around those areas. So one of the best things is with the roller. And so essentially what I do, so the spine is right in the middle, and be working on the muscles along the side of it. So I just put it just below my skull and just apply pressure as I roll down as far as I can go, which is the top of the neck to the bottom, the base of the neck. Just nice and slow. And the beauty of it is you control the amount of pressure. You know how much you can handle. And I'll do that around a minute. If it's really tender, I would probably spend a little more time. And then what I do is just kind of pivot out a little further to the outside. So a little more to the side. And just kind of keep working my way out. Working on that. Kind of, you're essentially massaging your own neck. Working that. So, it takes a couple of minutes to do one side and then a couple of minutes to the other side. Again, the alternative is something like this, which is essentially doing the same thing. If you're lucky, maybe you have somebody that actually wants to work on you or massage you, or if you want to pay for that, that's fine too. So whatever you can do to kind of work that tissue out. The other thing I do to get the tissue a little bit lower, because you can't really do it with the roller, is I take the ball, I place it up along the scapula or the shoulder blade while laying against the wall. Let's do this side so you can see better. And just kind of, I'm going up and down just along the inner edge of the shoulder blade in that upper trap. Just kind of looking for those knots, those tenderness, any of those areas that are just really sore. Just kind of work, just like a massage therapist, be kind of trying to dig that out a little bit. You control how much pressure. You know how much you can handle, but try to really get in there a little bit. Now I'll spend, depending on the soreness, a minute or two on that side, and a minute or two on the other side. I would kind of recommend working on some of this at the same thing, putting against the wall and getting these pectoralis muscles worked out, because those get really tight as we're working on the computer and our phones and driving and cooking and all kinds of different things like that. So after I get those areas rolled out, then I want to stretch it out. So it's a kind of a process of rolling it out, stretching out, working it out. So the best way to get the neck, so I'll kind of tilt and kind of rotate as I'm pulling. And I like to take this hand on this side and pull it down. It gets a little bit better of a stretch. So see how I'm kind of rotating away? So it gets a little more of a stretch in there. And then I'll just hold that for about 20 seconds. And I'm breathing the entire time. It's always important to always be breathing. Always be breathing. After I'm done, what I want to do is kind of, work it out. So I'm just going to contract it. 1, 2, 3, 4, 5. And what you can do is go back and stretch it to get even a little bit more. Maybe not as long, maybe about 10 seconds. Okay? Then I'm going to do the other side. Same thing. 20 seconds. And then contract. The contraction is literally the opposite of the stretch. When you're stretching it, you're lengthening it. When you're contracting it, you're shortening it. So 1, 2, 3, 4, 5. So just don't do it too hard, because you might, if you have a tendency to have spasms and things like that, it might tighten up a little bit. So that's why I like to do the contraction, then go right back into the stretch again. It'll continually help loosen up. Now, if you notice any kind of tightness, more kind of like on this area, there's a muscle called your SEM, which is short for sternocleidomastoid muscle. Connects right behind your ear and right to the proximal part of your clavicle on the top. And so what I like to do is just take my thumbs and just kind of dig right below that bony part where it connects. And I'll spend about 20 or 30 seconds just kind of digging in, just like that. Same thing on this side. 20 or 30 seconds. Same thing on this side. Okay, so I rolled it out. Now I want to stretch it out. I'll hold it, 20 seconds. 20 seconds, and then to contract it, you just do the other. I usually use my hand and kind of push against it. 1, 2, 3, 4, 5. Just 5 seconds of that. The other thing I find very important, especially for the neck, is what's called your thoracic spine. loses its position and its fluidity of movement. It doesn't work very well. So I take that, I'm going to go on the floor. Okay? You're going to do this preferably in between your shoulders. I used to do this, do not do this on the low, I don't like to do this on the low back. I find it makes everything worse. So above the low back, kind of where the spine where the ribs are attached. So we're just going to kind of show you right between the shoulder blades. So when you get to the shoulder blades, you're going to hug yourself. The reason is so you can pull the shoulder blades out of the way and get to the spine itself. And I just like to just lie here, let my body kind of lie over it, and make sure I breathe. I don't like anywhere from 10 to 20 seconds, and I curl up, and I roll up a little bit further. I'm going to stop before I get to my neck. So just where that little bony prominence at the bottom of your neck, you're going to stop before you get to that point. I just lie here. So if you feel a lot of pain, a lot of soreness, a lot of resistance in that area, that means that spine is not working. It's not moving, and it should be moving. So I want to make sure that process to help improve the position of it and just help the movement of it and the fluidity of that. So that, because if that area is moving, it helps the neck. If it's not moving, then it locks the neck up. So people that tend to have their neck lock up, they wake up with their neck locked up and they can't even turn. It usually comes from something in here locking up. And so that's where the Activator Methods chiropractic can really help get that loosened up as well, in conjunction with a lot of these exercises and stretches. So another thing that I would definitely recommend to do is some exercise to help correct that posture, because the muscles in the back here between the shoulder blades get really weak because we're on the computer, phones, and so forth. So this is where this little resistance band comes in handy. And a lot of people already have these at home, that's fine. So I just take it, kind of stretch it out, and then what I'm going to do is squeeze my shoulder blades together. I try not to, a lot of people tend to tilt their head. Keep your head nice and neutral. The other important thing is not to shrug your shoulders. You're almost like wanting to do the opposite. So keep the shoulders down as you're doing that. And the other little trick is to rotate your hands around. And what that's really doing is rotating the shoulders, externally rotating the shoulders. Because as we tend to work on our phones and the computers, we internally rotate those shoulders. So we're wanting to work the external rotators of our shoulders to help improve that. So the best thing to do is just do either repetitions, or you can just pull it and hold it. Now you can start with about 10 seconds and then work it up 20 to 30 seconds or longer if you can. Just make sure you're breathing. The last thing, and this is one of the most important that you can do, because you can do this periodically, just take a break from your work for a moment, is to put your hands behind your back, turn your thumbs out but your palms facing toward you, squeeze your shoulder blades together. If you can't do this, just keep your hands apart, but rotate your hands, squeeze your shoulder blades together, and then pull your shoulders down. And then from there, what you're going to do is, keeping your head straight, push it, like slide it forward and touch, and then pull it back. And then count to 3. 1, 2, 3. Do it again. 1, 2, 3. And I do that about 5 times. Then what I do is a tiny little movement, sliding it side to side. So I'm just going to go touch, touch, where I'm like pushing my ear, my side of my face, to one side, and do that 10 times. Then I rotate 10 times. Okay? And so the more you work on a computer, drive, and being in these kind of positions, a hairstylist, anything like that, you want to be doing that periodically, like ideally like every hour or even half hour, depending on how intense your work is. And so if you don't do that, everything, your body is forming in however positions you hold yourself in. So we end up with posture like this, where the muscles, the nerves are all stressed, causing all kinds of problems, and it's just going to get worse as we age. We end up in our elder years looking like this, and we can't even turn our head. So we don't want that. So if you have any questions, just give us a call at Alternative Health Management, 713-722-2580.